was looking for something that offered me a lot of operative experience. I knew I wanted to be like really good with my hands by the time I graduated and really comfortable in the OR, but also still kind of had like an academic side to it.
All of our colleagues, all of the general surgery residents are really fun people. You'll frequently see us staying after work, just hanging out and talking about our days with each other. We all have each other's backs and cover call for each other all the time.
We're all in this together sort of feeling, which is nice.
Right, you can pretty much get through anything if you like the people you're working with. All of these people here, they're kind of like my family away from home.
Our program is very much dedicated to having the residents maintain a work-life balance. It's surgical residency, so it's tough at times, but I think as a residency group, we maintain our balance together.
I mean, obviously we work hard. You know, that's part of being a general surgery resident. Going into a surgery residency, I kind of had this idea in my head that, you know, I'd never see my husband and, you know, I'd maybe never have time to enjoy life outside of work, but I think that really hasn't been the case.
Every 3 months, we try to have at least one event where the department sponsors us to go out and do something as a residency group.
They're really good at both, like giving you some independence so that you can get your feet wet and start actually being a doctor, which is, you know, both exciting and scary at the same time. But then also there that if you have any questions, like we're always free to ask them. It's a really good mix of letting us like grow into our roles as physicians while also being there to make sure that, you know, we don't mess up too bad.
Creighton is definitely unique in my opinion for a surgical culture because we're an academic center. We have all the complex cases, the high volume, the research opportunities, but our culture and the way we function is more like a community program. As a general surgery resident, you get to do all the complex vascular work, you get to do the Whipples, you get to do the esophagectomies, really you name it. It's a great balance between clinic experience and OR experience and then managing complex patients on the floor.
For most of our like general surgery services, you'll see the patients in clinic and then kind of follow them through, see them in the operating room, see them as an inpatient, send them home, see them in post-op. Creighton does a really good job of preparing you for your boards. Everybody was kind of like studying together and quizzing each other together in the months leading up to the AB site, and it was all just like really fun. It was like playing Jeopardy with everybody.
We have our education, our didactics every week, and they also give us a lot of other resources, like they pay for like a question bank for us every year. There's also the SCORE curriculum that they pay for us so that we can follow along with that as well. They give us like, even more resources than we have time to use. We're required to do QI every year. There's like a QI symposium and they kind of break us into teams and we work on it like with, and usually there's like one resident for each class and we're all on a team together and we work on the QI project from that standpoint. And then they do very strongly encourage like other research projects as well.
This year we've developed a quality improvement project based on kind of advanced directive end-of-life planning, kind of getting all that documentation in place before somebody's surgery, and so they can come into the surgery already kind of having had those conversations with their family.
Our research and QI opportunities here are tremendous. Every year we do multiple QI projects within our department, and that's really up to the resident to decide kind of how involved they want to be.
What makes it special is that I think whether you're looking for like an academic or a community program, this is like the perfect mixture of both of those. Our residents graduate from here very, very confident in their surgical abilities. And I've made some of the best friends of my life in this program, and I think I wouldn't want to be anywhere else in the world.